During the height of World War II, when the British intelligence intercepted an Enigma code from Germany. Now, an Enigma code is a type of messaging system, a secret messaging system, that requires a certain pattern or key to unlock it. Now, the British wanted to know what this hidden message is. The issue is, it would take really, really long for them to figure it out. Approximately like maybe weeks or even months to crack the code. However, one man named Alan Turing has invented a machine called the Turing machine. This Turing machine is tasked to decode the Enigma code. Now, what's really fascinating is that what would have taken months for humans to decode the message, the Turing machine managed to do it in a matter of minutes. This turned the tide of war for the Allies, and it's not just that. The Turing machine also laid the foundation of what we now call as artificial intelligence. Fast forward to today, we see AI all around us, from our smartphones and smart fridges to self-driving cars and personal AI assistants like chatbot GPT. Simply put, artificial intelligence is engraved in the part of our lives. But it doesn't stop there. Artificial intelligence is also used in various industrial and private sectors, such as automating accounting tasks in various banks. It is used for cybersecurity to prevent cyber attacks. And the last and prominent point is its implementation of artificial intelligence in medical science. Now, in a medical field, doctors and surgeons are bound to make mistakes. It doesn't matter how much experience they have, whether it be years or even decades, they will make mistakes. It is just part of human nature. And in a field like this where lives are involved, such risks, where lives are involved and they could die, such risks should not go unnoticed. With artificial intelligence, we can mitigate such risks and bring the mortality rate down to zero. Already, we see artificial intelligence being implemented in surgery in various different ways, such as for instance, it can diagnose patients and find a root problem for the operation to take place. And it can calculate before the operation takes place, it can calculate the most efficient route to perform the surgery, making it as efficiently and streamlined as possible. And the last point is that during the operation, it can help and assist with surgeons with various difficult decisions. So the three examples I mentioned before have one thing in common. They only assist with surgeons. They don't help them. But we can take that a step further. How? By creating an AI that will perform surgeries on its own without any human supervision. But how can we achieve such goal? To do that, we need to accomplish three goals. One, it needs the data collected and recorded from other surgeries performed around the world. Second, it of course needs an AI that is capable of doing such a daunting task. And number three, it needs an AI is as redundant without its contemporary hardware. So it needs a machine capable of doing performing precision level tasks. The graph you're seeing here right now is composed of number of surgeries performed each year. In total, there are 310 million surgeries performed. 50 million of them are in the United States alone, and meanwhile the 20 million are in Europe. Now, we have to assume that every surgery performed ever in the said year is recorded and stored in the database. Once we collect the data and have access to the data, we can use it to train our AI model. Now, how an AI works and how it trains itself is much more complicated, but I won't bore you with the details. I'll just simplify it down to 3 steps. 1. When AI receives the data through input, it will start to filter out the information through machine learning. And through that, it will start to recognize patterns, learn patterns. After it's done that, it will rely on sensory cues, such as being able to see through the camera or hear through the microphone. Through that, it will be able to predict what will come next and plan accordingly. And the last step is, once it is aware of its situation, it can start to execute its task. But before it can execute it, it needs to find the most probable route with the 100% success rate. After that, after it is sure that it can achieve such a task, it will execute it. So now we have an AI that can comprehend and understand what is happening. But we also need a machine that is capable of performing such delicate tasks. And what better device to mention than the Da Vinci surgical system? Now, this surgical system isn't very particularly interesting. You may not even recognize it. However, what you will recognize is the operation it has performed on. The infamous grape surgery. Most of you may have remembered this picture back in 2018 as it went viral, and yeah, most of you may see it as some sort of joke, which I don't really blame you. They're just peeling a skin off a grape. What's so special about that? But to the scientific community, it really was special. Why? Because a machine managed to peel off a skin and sewn it back together with its metal arms and with precise skill. I don't know any other machine that can perform such a task like that. Which is why I believe this machine is the perfect for the job. Now, the last question you guys might be asking is, where is this technology? When will it be implemented? Why is it not here yet? Well, for that, I'll tell you why. For one, it is a decades-old ongoing research, and it has started since the 1980s. In fact, the first ever implementation of artificial intelligence in surgery was a Puma 560 used in a biopsy operation to stabilize the brain activity. And yes, we are still decades away. And secondly, remember in the graph page I showed you, remember what I mentioned that there are 310 million data stored in the databases. I've also mentioned that it is with a strong assumption that these surgeries are recorded, and even if they are, I'm afraid that some countries may not like to share their databases across the world, whether it be for political reasons or the infrastructure does not allow for it, or they would like to do research on their own. And the final point I would like to talk about is that in any experiments in any other industry, like engineering, we progress and advance by trial and error. However, in this case, in the medical science, we cannot afford such luxury because first of all, lives are on the line, and we cannot waste such lives just for the sake of science. We can't do it all the time. That being said, it does not mean that the goal to create artificial intelligence that can operate on its own is impossible. It is possible, but we should keep in mind that such progress is at a staggering low pace. But if we keep funding our scientists and provide them with resources, we may be able to achieve the goal and step into the next evolution of medical science. If you have any further questions, you can contact me via my email. And yes, thank you everyone for listening. Thank you everyone for listening. I would like to personally thank Mrs. Tahiri and Mr. Jiva for organizing such a beautiful event. And I would also like to thank Pardia and Sina for hosting and announcing for today's event. Thank you everyone, and goodbye.